Dear viewers, welcome you all to our show Orthopedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation. Dear viewers, today our topic is some interesting and difficult cases treated by Ilizarov. And the speaker is the one and only, the legendary Ilizarov surgeon in Bangladesh, Professor Mofakkarul Barisal. I would like to request Professor Mofakkarul Barisal to join with us.
Thank you, Tanvir, for introducing me. Thank you, everyone.
Welcome, sir. Welcome to our show, Orthopedic Solution Academy. Dear viewers, we have two learned academic experts. One is highly academician, Professor Novikov sir from Kurgan, Russia. I would like to request Professor Novikov sir to join with us.
Good afternoon, colleagues.
Good afternoon, sir. And the another one is very enthusiastic Elizabeth surgeon from Patna, India, Dr. Shamsul Huda sir. I would like to request Dr. Shamsul Huda sir to join with us.
Thank you. Good afternoon, Dr. Tanvir.
Thank you very much, sir, for joining with us. Dear viewers, we all know that we can do many things by Ilizarov, and we pick up some interesting and difficult cases that we manage by Ilizarov. And today, our honorable speaker, Professor Mofakkarul Barisal, will show you that interesting and difficult cases. So I'd like to request Professor Mofakkarul Barisal to share his screen. Sir, would you please share your screen with us?
Okay. Thank you, dear friends. Thank you, Tanvir. And dear viewers and my friends, today I'd like to talk, and at the same time, I'd like to show you some very difficult and interesting cases. These cases only you can treat by Ilizarov. And fantastically, you can treat all these cases. I have picked up some of the cases. It is very difficult to take all the cases in a single lecture. And that's why I have taken some very difficult and interesting cases. What you can do in Ilizarov with all these cases. So this is I love to show, I told you, the orthopedic capital. In winter season and in summer season, you can see.
Sir, we cannot see your slide now. Sir.
Slide? You
No,
don't
sir, we
see
can't
now?
see your slide. No, sir, we can't see your slide, sir.
No? You cannot see?
Not yet, sir.
Что, английский разумеете, нет? Ну, посмотрим. Сейчас проверим.
Вот так, степ-бай-степ, а тебе мир узнает. Самое главное, мир этого хочет.
You cannot see my slides.
Включимся.
Oi.
ওই কিন্তু শেয়ারই করা যায়
So.
শেয়ার করতে হবে না এখান থেকে
Okay. Now you can?
Yes, sir.
Okay.
We can see the slide and we can hear you perfectly.
Sorry for the interruption. Dear friends, my dear friends and viewers, today I would like to talk on some very interesting and difficult cases that we can treat by Ilizarov. I have picked up most of the very difficult cases, and I would like to show you how we can manage, how we can treat all these difficult cases by Ilizarov technique. So far, I have seen, and I am thinking that without Ilizarov, we cannot solve nicely or fantastically all these difficult cases. So this is the center. Every time I love to show this center. And each day is a challenge. And challenge never ends. Challenge is an opportunity to solve the unsolved problems, especially those which are need-based. There are common problems that concern us all, the majority and the society at large. Why Ilizarov? if you just think about the all alphabets, I, you must have some intelligent. You can L, you can go for lengthening, whatever you like. Again, I, infection you can control. Z, zigzag, that means any kind of deformity you can correct. A, you are getting angiogenesis when you are giving distraction or compression, and this is adaptable. R, that is reliable. And O, you have got a lot of opportunities when you are applying Ilizarov. And finally, you can get victory, and this is a versatile instrument. Ilizarov serves four purposes. What are the four purposes? Number one, it gives mechanical stability, which is absolutely necessary for bones and joints. And number two, when you are giving mechanical stability, you are giving compression or distraction, you're getting billions of cells around the line of compression or distraction. And in most of the cases, Professor Ilizarov showed that 330% circulation is increased when you are applying Ilizarov, and you are not damaging anything. That is the beauty of Ilizarov. Now, let us see some interesting cases. Dear friends, you can see here non-union right lower femur segmental tibia. We can say this is a floating knee. Look at the right side and look at the left side. So this is a conventional method treated elsewhere with plates and screws. And then you see uniaxial fixator. Look at the x-rays. This is, you are looking only the x-rays. And soft tissue you don't see here. See, this is the segmental, and this is, you see, big gap here. And it was managed by Ilizarov fixator. See, she was treated outside my country. And my one fellow from Nigeria, she was treated outside my country with plates and screws. Look at this here. Here you can see with grafting of the fibula. And then she came to my place with broken plates. Look at here. And then what I did, you see, I removed everything with small incision. I put out the plate, and then look here. I have done look at here. I have done the corticotomy here. This is the lengthening part, and put one guide wire so that you cannot deviate the bones to maintain the mechanical axis. And here you can see, and this is the radiographic view after 1 month of application of Ilizarov. And this is the after 4 months of application of Ilizarov. Look at this here, first ring, second ring, and with hinges. And this is the external view of the patient. And this is the radiographic view after 1 year. And you can see here, from this situation, it's a very difficult case. The leg was like that. See the deviation, how she was standing. After 1 year, you can see the full consolidation with callus formation. And this is after 1 year and 2 months follow-up. From this situation to that situation, this is a very difficult case. And what I have shown you, without Ilizarov, it is very difficult to treat. Before applying the Ilizarov, she was treated 2 times by an orthopedic surgeon. Now, what to do here? Look at this gap non-union, very bad case. The more difficult the case, the more is the Ilizarov. Now, Ilizarov keep you safe, plan to realign, and preoperative planning is very important. Now, look at these here. Gap from here to here. This is the subtrochanteric region and very big gap. The bone was exposed and it was fallen down in the street. Then the boy came to my place. This is the bone. See, very big bone, traumatic exposed bone. Came to my place. He was applied. The uniaxial fixator was applied elsewhere. Then he came to my place after 28 days. Then I took it as a challenge. I was thinking what to do. The patient came to my place with the bone and told me, "Sir, try to put my bone here." The bone that was fall down in the ground, and he told me to put it here. And it was I told him, "Is it possible? After 28 days, you came to a place. How can I do that?" Then I started lengthening. And there was at the same time, lower end of the tibia, comminuted fracture, open fracture. Then you see, I started lengthening of the subtrochanteric region here. And there was a periosteum was remained here, and something was growing. When I was, after application of the Ilizarov, a few days later, I saw this is bone, something is coming here. Now, this is a very thin bone, and this is the lengthening part. You see, I have lengthened it one, and lengthened this one, and this is, I kept it like that, and then I started, lengthening. You see, this is already lengthening part, and still the big gap is remained here. I put the olive and tried to hold this fragment, but unfortunately, the bone was so small. Then I decided to go from a little bone here for destruction from the lower end. And then I started destruction from the lower end. You can see here, this is coming up, and this is already consolidated bone. And then there is a gap here. Again, I lengthen from this side, and this is the lengthening part, remaining here a little bit here. Then look at this. This is the lengthening part from the lower end. This is from the upper end. Then I open it up. Then I fix it with Ilizarov apparatus. Removed whole bone. This is the very big gap. It was near about 23 centimeter. That was lengthening part of the whole femur. So this is the beauty of Ilizarov. And this is, you can see here, very difficult case. 32 years government college teacher. Look at this, how he was walking. Look at the standing. Look at the patella tracking from the lateral side. You can see here. This. Look at this. Look at this. And now the deviation of this valgus you can see, and deformity of the ankle and the foot, and at the same time in all the toes, the claw toes. Now he came to my place. How I can help this gentleman? He is a teacher in the government college. Then I started doing from the opening wedge from the femur, lateral side. You can see here, started lengthening from the lateral side, and after a few days, I started doing the correction of the whole tibia, ankle, and foot. Now you can see the whole corrected. You can see the whole femur. See the corrected femur, and after 9 months follow-up, he was walking, he was standing with the brace. It's very good correction was done. This is his case, you can see here, 15 years, not 16, here is written wrong. 15 years old boy came to my place, and probably this is the case, very difficult. I have not done any osteotomy here. I have done the metaphyseal epiphyseal growth plate destruction, that is called chondrodiastasis, from both sides from the tibia, considering the age of the patient, because 15 years, the closing end of the boy, then I started destruction from the tibia, here epiphyseolysis, here epiphyseolysis, you can see the bowing, then without cutting any bone, there's chondrodiastasis. Look at this, at the age of 15, this is, I have done this. And if you could do this, patient came to my place late, at the age of 12 or 13, you could do that. Why I have taken that as a challenge, that I should try. And I have tried that one. I have distracted from epiphysis to metaphysis in the lower femur and at the same time in the upper tibia. That is called chondrodiastasis. Then you can see here, after correcting the femur and tibia, now you can see the straight whole leg. This is the axis you can see, and this is how he was walking with the apparatus without cutting any bone, only separation of the epiphysis and metaphysis. Now look here, how he was walking like that. This is only after 5 months treatment. So, difficult case at the age of 15, you can help the patient and you can correct the patient. Now look at this friend. This is after correction. This is before, only epiphysis and metaphysis separation. Here also like that, you put the hinges and then you can correct. Now look at this before radiographic view and after removal of the radiograph X-ray. You can see here. Now this is the case, you can see it bit difficult. 3 times surgery was done with relapse CTV by PMR, by other orthopedic surgeons. You can see backside, age is 14. You don't need to do any osteotomy. Look at this here. This is the bony scar, hardened tissue, and then 14 years, mind it. Gradually, I have put the Ilizarov from here to here and in the toes also. And then I corrected this one. Now look at this, without doing any kind of osteotomy. If you look from the front side and from the back side, look here. Beautifully, that is almost more than 95 to 100% correction, I can tell you, is corrected by application of Ilizarov. Gradual, controlled, coordinated stretching was done. Now, this is a case you can see here. Boy is 20 years old. What are the problems you can see here? Septic equinus deformity of the left ankle, subluxation in combination with fast metatarsophalangeal joint deformity of 90 degree. Look at this skin here, downwards with 7 centimeter LLD of the left leg, with bad scar and hard skin discoloration in dorsum of the great toe. These are the cases, 20 years. He was walking like that. Look at this. How you can do bad skin? Only you can correct with, if you properly apply the Ilizarov, you can correct this kind of deformity. Look at this, young chap, only 20 years old. And what I have done, you can see here, mini Ilizarov, put from that side, you can see, gradually I have lifted up the great toe by putting the Ilizarov only with biocompatible thin wires. Now look at the radiographic view, calcaneum and whole foot and the great toe placement. And then gradually, I have distracted. Everything must be done gradually. That is the beauty of Ilizarov, so that you can get all kinds of tissue genesis. When you are applying distraction, you are getting skin dermatogenesis, myogenesis, neogenesis, neurogenesis, and osteogenesis at the same time. And I have lengthened the tibia, and you can see here, from that situation, dear friends, just have a look. Last have a look. This is the full-length X-ray, and this is after correction. Just whenever I have dismounted the apparatus, I put the brace, and then this is the final view of the just after removal and standing clinical appearance of the patient with ankle equinus correction and fast metatarsal joint correction, you can see here. So this is the beauty of Ilizarov. This is published in MedCrave American Journal in 2021-17 of September. And now look at this 25 years old man. Just see, if you see the X-ray, you will be able to understand, though this is not a very difficult case. But what is your diagnosis? Look at this. Double plating and screws were done elsewhere because it was a segmental fracture. Now, came to my place with this, I have removed, look at this. Now, quality of the bone, and if you look at the plate and screws, then you will be able to understand in this situation, local temperature and discharging of the pass was coming, dribbling pass, and what will be your plan? See, and what I have done, put this one during treatment. And this so now you can see here after 1 year and 3 months, good callus formation, only with Ilizarov young chap, you can see the result. See, dear gentlemen, all these cages that so far I have shown you, difficult, and this cage you can see the bilateral genovalgum with patellar tracking laterally. How he was working. He is a student of graduation. He is doing graduation in a Dhaka city in a college. Then he came to my place. He was walking like that. Look at the patella and look at this. So severe, bone quality is not good. And how you can help with this, help this patient. Then gradually I have applied with only with biocompatible thin wires. No shunts I have used. You can see here. Only in the top of the femur I use, not in the tibia. And bifocal transportation of the bone and lengthening and deformity correction. Patient was getting exercises during treatment. And from that situation, here you can see here and see the whole application of the Ilizarov in the femur and in the tibia. This is the situation. If you look at this, it will look very clumsy. But sequentially, if you go for correction of the Ilizarov apparatus with thin wires, you will get a very fantastic good result. Now, another case you can see here. This is a son of army personnel. Look at this. Genovalgum, procurvatum, 10 centimeter LLD. Look at the back side. Look the situation of the standing, how he's standing. Look at the skin from the back side. You can see here, scar tissue. Here, see, puckering of the skin. And look at the X-ray. When you are doing the X-ray in the full length, you will see the view of the X-ray and the deformity and from the back side. And then you just go for opening wedge osteotomy here, from here, by applying 1, 2, and 3. And at the same time in the tibia, see, I have done the osteotomy, put this with, corrected with hinges application. And this is the radiographic view during treatment. You can see after 26 days. And now patient with Ilizarov external fixator after 2 months. Look at the bone consolidation, opening wedge. Look at the radiograph with good regenerate bone. And at the same time, now you can compare front view of the patient before dismounting the Ilizarov apparatus. And before, you can see the skin. You can see the skin here. You can see this small incision, a small incision, and gradual destruction. If you do that, you will get a very good, dermatogenesis here. You can see here. This is the shortening 10 centimeter and puckering of the skin, front and back view, and look at the X-ray and look at this here. Now, from this situation to that situation and this situation, look, this is the fantastically, we have corrected this kind of deformity with puckering of the skin and 10 centimeter LLD. This is also published in journal in May 17 of this month. See, look at this. Type 3, according to Pele, 3B, look at this. Tibial hemimelia, fibula is okay, tibia shortened, and this, if you look at this classification, type 3B, then she was trouble in my country, went to the several orthopedic surgeons, and of course in India also. They advised her father. Father was the deputy director of our Director General of Health Office, and they advised her to go for amputation. And then came to my place. I have corrected this young girl during treatment. Look at this, what I have done. See the one ring here, telescopic rod, lengthening, correction of the lower end ankle. Look at the ankle and the foot. If you look at this sequentially here, you'll be able to understand the situation from that to this situation. Look at this. Look at this. So this is the, I have done the arthrodesis and see full length, full consolidation of the bone. And from this situation, before, back, ankle was back, unstable ankle. From this ankle to this ankle, see the quality of the bone, and she is happy. And so this is the view that you can see here. She was walking like that. She was walking like that. I'm going to show the, oh, I'm sorry that I could not show the previous one. So beautifully that was corrected. Now you can see here, this is before. She was walking like that. And this is after the correction of the, I'm sorry, this is not running, no. This is beautifully corrected, and now you can see here. Oh, now see how she's walking. This is after correction of the 3B type tibial hemimelia. Now, dear friends, another difficult case. 70 years old female, post-infective left forearm with deformity. These are the cases, challenging cases with ulnar deviation at the age of 4. Again, I have corrected. How I have corrected, you just look here. Ulnar lengthening, deformity correction in the distal radius and ulna, and I have put the half ring in the metacarpal bones. This is, you can see the external view. If you look at this radiographic view, you can see the lengthening, Ilizarov fixation, and we put the Ilizarov, and after 10 months follow-up, you can see here, from this situation, AP lateral view, you can see from that situation, a final follow-up after 1 year. You can compare, see here and see here. So this is the case. Again, plating
Sir, we cannot hear you properly, sir. I think you're facing a network problem there.
situation, and then I have treated the gentleman as a teacher. After 6 months follow-up, from that situation to this situation, after 5 months, you can see. So, before and final follow-up after 1 year. Now you can see here, from this situation, it's a bad case very, and these are the challenging cases. Now, no infection, nothing, bone is healed, no sinus, nothing. Now see how he is doing. Again, I'm showing you, dear friends, these are the cases that you can solve beautifully by Ilizarov technique. And this is the case. See, monkey mouth deformity. That is, I have given the name, this monkey mouth deformity. You see the monkey face like this, deformity here, see. These are the cases. You can go for osteotomy, bone grafting, and lot of things, whatever you like, you can do. But only with the Ilizarov, very fantastically you can correct. Initially, I put the 2 rings, 1 ring here and 2 below, and with hinges, given the distraction, you can see, and gradually I have corrected that one. Now from this situation to this situation, you can see full consolidation and no monkey mouth here. Then you just compare this monkey mouth to, this is the after 6 years follow-up. He's working in Saudi Arabia now. Bony bump, see the front from the back, and this is the beauty of Ilizarov. So the patient is happy, relative is happy. Now you can see after 6 years follow-up, no deformity, no problem. You can see it very nicely, without any pain, without any complication. So this is also one of the complicated cases that you can solve by Ilizarov. These are the cases that I'm showing you. The whenever I do any difficult case, I want to keep it in paper, and these are the publications. Several things you can see here: the bowing deformities, Judas quadriceps, and Shepherd crook, and this is also case, difficult case. If you know the technique, of course, you can do this kind of lengthening with iniaxial fixator, but I love to do with this post-septic 11 centimeter shortening by Ilizarov technique. Look at this, back and front. Beautiful girl, but you should have to distract. You should have to correct. 2-level osteotomy I have done, only with biocompatible thin wires and olive wires. Then whenever you put the apparatus, you allow your patient to go for exercises. So see, this is after 10 months follow-up. You must put the apparatus. After putting the apparatus, you allow the patient to do the exercises, and patient is getting very good comfort when he or she is doing exercises. Now this is, you can see here, this is the short femur, and this is the lengthening with full consolidation after 8 months, 11 months. Now level of the both, elbow, you can see the same. This is before and this is after. This is also lengthening in publication. Now, this is the case. What is the diagnosis? You can see here. 12 years old girl, beautiful girl, just like full procurvatum you can see. And from the front view, lateral view, you can see the full one, procurvatum, quality of the bone is not good. And then, see, pathological fracture was there. If you look at this, and then I have treated this patient with Ilizarov technique, and it was 6 years back, and then see before and after. Just look the progress from this situation to that situation. This is lateral view, this is the AP view. And now see here, this is the view that she was standing like that, and without any complaints. After 2 years follow-up, she is happy with her leg, and without any difficulties, without any problem, she can walk easily. Now, this is the case probably I've shown you. Look at these dear friends, at the age of 9 years, came to my place. If you have Ilizarov, you can think and you can do something. Look at this. What I have done, primary just this one, down the osteotomy here, and fibula from this side, translated the fibula, and then I have lengthened. Look at this, the bony support, full consolidation, and then you can see here from this situation to that situation after 1 year follow-up. See, and this is after 2 years follow-up. Same boy, you can see here, serpentine deformity, snake-like deformity from this situation to this situation, front view and back view. So these are the difficult cases that you can do. This is a girl from Myanmar, came to my place to go for doing this deformity correction. See, look at this. Look at this. Now look at this. This is the situation. She came from Yangon, Myanmar. 11 centimeter ALLD, post-infective deformity, depressed medial plateau. What I have done with hinges, these are the hinges, lateral side, gradual opening wise destruction. Now look at this plateau, tibial plateau. This is almost 180 degree, greater than 75, depressed tibial plateau. Look at this. From this situation, tibial plateau must be like this. This is oblique. And then I have done the osteotomy, gradual elevation of the medial side with putting the hinges from their side. It is almost corrected. Look at this, and this is the view before, and this is after 1 year follow-up. And now, see, she was walking like that, standing of the whole foot you can see, and see the knee, painful. It was a painful, and she was walking like that after correcting, and this is the external view from back side and from front side. So these are the cases that you can easily, and if you're meticulous, if you know the principle, then you can correct everything. Dear friends, bilateral bowing deformity of femur and tibia due to rickets. He has come from Dubai. Parents are staying in Dubai, came to my place, see very ricket, very difficult case, and then look at this opening wedge, tibia. Here you can see patella was laterally almost backside. Then I pulled this patella, and then I have corrected that one. This is the final, of course, almost final. You can see correctly. We have corrected from that situation to this situation. So, dear friends, what I have shown you in cosmesis and deformity correction, excellence is achieved by correcting the correct deformity at the correct coda, based on correct planning, by the correct method to achieve the correct correction. Here, this is very important. Whenever you're doing any kind of deformity correction, you should have to think about the map, mechanical axis, anatomical axis, and you should have to make a plan. So, and finally, I would like to tell you what I've shown you. This is my evidence. I show this slide because evidence and on the basis of science, and at the same time, the surgical skill of the surgeon is very important. And you know, whenever you are doing Ilizarov, you must respect the biology. And this is the combination of mechanical and biological. And we can go for a very cost effective technique that is called Ilizarov. And we are doing a lot of cases, in difficult cases in our country, Bangladesh. And this is my mentor, my Professor Shepsov, and these are the books. Until today, 93 international publications. After 7 books, it will be 100. So I am happy that we are helping the poor people, and I must convey my gratitude to this great scientist, Gabriel Abramovich Ilizarov. Due to his, innovation, lots of people in the world getting a good result regarding all these congenital post-traumatic acquired deformities of the human being. Thank you so much for your kind attention.
Thank you very much, sir. Definitely, excellency is only achieved by doing excellent work and an excellent presentation by an excellent presenter like you, Professor Mufakrul Barisar. Thank you very much, sir, for your excellent presentation. Dear viewers, we came to know that there are lots of cases. If there is no hope, there is a hope, and that is the Elizarov. Now, I would like to request Professor Novikov, sir, to share his experience regarding our present topic. Professor Novikov, sir, would you please share your experience?
One more good afternoon, dear colleagues and Professor Barry. I want to say from my heart, thank you very much for your experience, for your support. And I want to say this is a method not only for poor people. This is message for all of patients, orthopedic trauma case. But just now, when I saw your presentation, your magic, unbelievable results, I can say, I want to say, this is treatment, this is methods for all of patients, but not for all of doctor. Now, Dr. Barry show during the treatment 6-8 months. I want to ask colleagues, who from you already spent 8 months for one patient? This is our message for little bit crazy doctor who is ready spend all of life, because after surgery we cannot live. All of period of treatment we need to be near with patient, and our result not in operation theater. Our result will come after many months, and sometimes doctor against to method Ilizarov because after few days, after few months, come problem, come complications, and this is doctor not spend his own time. And one more, Dr. Barry, my friend, my colleagues, this is magic methods of treatment for all of patients, but this is my solution. This is methods not for all of doctor. And if doctor not have enough experience, if doctor not have expert, all doctor like Barry, please not use method Ilizarov, because this is will как
Слово скажи, пожалуйста.
не провоцировать, а дискредитировать. This is like discreditation of our methods. And better when we work with team. And Dr. Barry, very excellent expert, but he has team. This is methods not for one doctor. This is methods for special clinic, for special team. And with results, finally, all of these patients we can help only with Ilizarov. Thank you, Barry. You great surgeon. Thank you.
Thank you very much.
Thank you, sir. Thank you very much. Now, I would like to request Dr. Shamsulda sir to share his experience regarding our presentation today.
Thank you, Dr. Tanvir. I was really spellbound seeing all the magical and so difficult cases of Ilizarov by Dr. Barisa, our mentor. So the message goes to the whole world that after having Ilizarov, no limb shall have any deformity, any shortening, and all limbs can be salvaged. No need for amputation or living a crippled life. Thank you, sir. Thanks a lot, sir. It's a wonderful case, sir.
Thank you.
Thank you very much. Yeah, really, that was an excellent presentation, and hope we can discover many things, and we can do lots of cases that it is impossible by other surgeons, but we can do it by Ilizarov. Thank you very much, sir. Thank you very much for your excellent presentation and showing us difficult cases so that we can follow your instructions. Dear viewers, I would like to thank Raj TV for helping us to arrange this type of program, and definitely Renata Pharmaceuticals Bangladesh Limited for sponsoring our program. I'm Dr. Mohammad Tanvir Ashraf saying bye-bye to you, and hope we will see you in the next Friday with another excellent topic of magical Ilizarov. Till then, bye-bye.
Thank you.
Thank you. Bye.
Thank you
You
very
are
much.
watching Raj TV, Jagorani, Bangladesh. Please subscribe our channel.